today we'll be discussing about subacute sclerosing panencephalitis. The subacute sclerosing panencephalitis means it is a chronic measles virus infection. So coming to the name, subacute is slowly progressive, and sclerosing, the name of this chronic measles virus infection, which is called subacute sclerosing panencephalitis. There is a sclerosis in histopathological examination of the brain, so it is called sclerosing. The name sclerosing is given to this because of this histopathological feature. And then panencephalitis, there is an inflammation of cerebral parenchyma, so it is called panencephalitis. It was first termed by Dawson as inclusion body encephalitis in the year 1934. Again, this is termed as subacute sclerosing panencephalitis by von Bogaert. So as I already said, this is a chronic measles virus infection, but it is a rare disease. It occurs at 1 case per 1 million children. The clinical features are, before going to the clinical features, how does this occur? The children less than 2 years, they have primary measles infection. After that, it is followed by an asymptomatic phase for at least 6 to 8 years, and then the symptoms of Sspe occurs. Those symptoms include, they can be present in various stages. First, they have decreased scholastic performance. There's a decreased proficiency at the school, and they have some personality changes like temper outbursts, and then they have language difficulties, and they have loss of interest in her daily activities. These language difficulties can be in the form of loss of comprehension, ability to understand the words, ability to name the words, and then they have loss of interest. This is followed by progressive intellectual deterioration. Okay, they don't have the normal intellect, and they have mentally retarded. So these patients have a progressive intellectual deterioration. So they have progressive intellectual deterioration, so they have mental retardations, and further they present with seizures. Seizures can be focal seizures or generalized tonic-clonic seizures, and they have myoclonus. This myoclonus is in Sspe is a type of slow myoclonus, that is can be present. It is a cortical type of myoclonus, can be present in any part of the body. It can present as jerk involving all the body parts. Then they have ataxia. Ataxia is imbalance while or incoordination while performing their daily activities. This stage is followed by presence of visual disturbances. They can't see what's there. That is secondary to the chorioretinitis. Followed by, there are some extrapyramidal features. These extrapyramidal features in the form of rigidity, and pyramidal features can be there where the plantars or extensors and raised DTRs. DTRs will be brisk. Followed by autonomic dysfunction, and the final stage is they have decorticate posturing. From the onset of illness to the death, it is the time gap is like 1 to 3 years. Within 1 to 3 years, these people will go to deathbed. Coming to the EEG. So coming to the EEG of this measles infection or Sspe, the signature EEG is the presence of generalized periodic discharges. So for every 5 to 8 seconds, we find 2 to 3 slow waves which are very high amplitude slow waves. So there are 2 to 3 per second, and in between the bursts of slow waves we have a flat EEG. That flat EEG is suppressed. This background activity is suppressed in between those bursts. To the CSF, we know cells but raised protein content. It is secondary to increased gamma globulin fraction. This also could be secondary to this measles antibodies. Presence of these measles antibodies causes increased gamma globulin fraction, and oligoclonal bands would be positive. And anti-measles antibodies are also positive. These are positive in both serum and CSF. Presence of these anti-measles antibodies, and also the presence of this generalized periodic discharges in EEG is suggestive of almost like probable diagnosis of measles. When it is definite, when the definite diagnosis of measles depends upon the histopathological examination, the presence of inclusion bodies, which I will be showing it to you in histopathological examination. Coming to the MRI findings, they have hyperintensities, white matter subcortical hyperintensities, which may progress into periventricular region. These are flare hyperintensities. Then coming to the histopathological examination, it involves both gray matter and white matter. In the gray matter, the neurons, they have been phagocytized by monocytes and macrophages. So these are seen in perivascular region. It's called perivascular cuffing of monocytes and macrophages, and neurons are also phagocytized. So there is neuronophagia with perivascular cuffing. The white matter, the axon and myelin both are degenerated, and here also we find a mononuclear cells which are present in the perivascular region, mononuclear cells. When these mononuclear cells they invade this myelin and axon, they cause destruction of this due to inflammation. Secondary fibrous gliosis happens there. So this fibrous gliosis is also called sclerosis. That's why we got the name as subacute sclerosing panencephalitis. So the hallmark, how can we diagnose this histopathologically, is the presence of these inclusion bodies, which are called eosinophilic inclusion bodies. They are seen in both cytoplasm and also in the nucleus. This is hallmark of Sspe. There was no specific treatment till now, but experimental therapies including amantadine and isoprinosine pranopex are prescribed. This is about the Sspe. It's called subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis. Thank you.